How is induration measured in a TST for tuberculosis? Imagine a tiny bump on your arm after a tuberculosis test. That bump is called induration, and measuring it correctly is key to understanding your test results. When a healthcare professional performs a tuberculin skin test, they inject a small amount of purified protein derivative into the skin of your forearm. After about 48 to 72 hours, they come back to check the site. The goal is to see how your immune system responded to the test. To measure the induration, the healthcare worker gently feels the area with their fingertips to find the edges of the raised, firm, and dense area. They do not focus on redness or erythema, because redness alone does not indicate a positive reaction. Once they locate the edges, they use a millimeter ruler to measure the diameter of the induration across the forearm. The measurement is taken perpendicular to the long axis of your arm, from one edge of the raised area to the opposite edge. If the induration is irregularly shaped, they measure the longest diameter. If there is no induration at all, they record a measurement of 0 millimeters. The size of the induration is then compared to established cutoff points, which vary depending on your risk factors. For example, a measurement of 5 millimeters or more might be considered positive in people with high risk, such as those with HIV or recent contact with tuberculosis. For others, a threshold of 10 or 15 millimeters might be used to interpret the test. It is very important that only the induration is measured, not the surrounding redness. The reading must happen within the specified 48 to 72 hours after the injection. If it is read too late, the test might need to be repeated for accurate results. This precise measurement helps doctors determine whether your immune system has been exposed to tuberculosis bacteria or if you have been vaccinated. Remember, always consult a healthcare professional for proper interpretation and next steps based on your test results.